Hello again and welcome to chapter 28. This is part 1 of 4 videos that I have you guys to watch. Please make sure that your children are not around, just like I informed you guys in chapter 27 with the male reproductive system, due to the very graphic pictures that we're going to have and the information that we're going to discuss. Alright, so the female reproductive system is more complex than the male system, and that's because it serves more purposes. It produces and delivers gametes. It provides nutrition and safe harboring for a fetal development. It's also there to help with giving birth and as well as making sure the infant is properly nourished. Now the female system is more cyclic, and of course hormones are secreted in a more complex sequence. Right, so within this particular section, these are the various objectives that we are going to take a look at. Looking at the blood supply to the female reproductive tract. So the ligaments that are going to support the reproductive tract, identifying the exterior genitalia of the female, as well as basically the structure of the ovaries. Alright, so the female reproductive system is, of course, very obvious from the males, correct? Now, but the structures are indistinguishable for the first 8 to 10 weeks. So we can't distinguish what a female may have within that first 8 to 10 weeks. We do not know, only till after, which we discussed in the very first chapter. Now, the female reproductive tract, it develops from the mesonephric ducts, and that's because of the absence of the testosterone and the MIF, which is this type of inhibiting factor. Now, without testosterone, the mesonephric duct, it starts to disintegrate. It starts to disintegrate. And the genitalia tubercles, they become the glands for the clitoris, which we discussed, or I showed you guys in chapter 27, how various structures form the clitoris, or how they form the penis and everything else. Okay. Now, without the MIF factor, the paramesonephric duct, it develops into the uterine tubes and, of course, the uterus. Right, so make sure you know what happens and what will develop if these two are not there. If there's no testosterone, what's going to develop, and if there's no MIF, that inhibiting factor, what will occur? Okay. Now, when we look at the genitalia, the internal genitalia is what we're looking at. It includes the ovaries and a duct system that runs from each ovary to the outside of the body. So we're looking at the ovary, the uterine tubes, the uterus, and the vagina. Those are considered your internal genitalia. Now, the external genitalia, we're dealing with the clitoris, the labia minora, and the majora. Okay? And the primary sex organs are our ovaries, and the secondary sex organs are the internal and the external genitalia. Those are secondary organs. Alright, so when we talk about the ovary, alright, so we're looking at the when we talk about the ovaries, looking at the female gonoids that produce the eggs, the egg cells called the ovum, and the sex hormones. So I'm going to move ahead to a picture. You guys can follow along with your PowerPoint notes. But I'm going to go ahead and move to this slide so you can see exactly what I'm talking about. So this is the ovaries. In the previous slides, I'm going to go back, skip it around. This is where it's located. You see we have the uterus, we have the vagina, and you see that the ovaries, we have one on either side, located on either side of the uterus. And these are the fallopian tubes. So let me jump ahead to the structure. So when I'm calling out these big terms, you guys can actually see what I'm talking about. So here we have the ovary. It is shaped like an almond, and it's measured about 3 centimeters long and 1.5 centimeters wide, and then 1 centimeter thick. Now, its capsule is called the tunica albuginum, which is right around here. This is considered to be the capsule, and it's just like the one that the testes have. Now, the interior of the ovary is indistinctly divided into the outer cortex, where the germ cells are going to develop, and a central medulla, which is occupied by the various arteries and our veins. So this area would be your central medulla, and then this outer area will be your outer cortex. Okay. Now the ovaries, they lack ducts. So you see they don't have any ducts within them, comparable to the seminiferous tubules. Instead, each eggs develop in its own fluid-filled, bubble-like follicle. Okay, here are these little follicles. Now, several types of follicles will coincide with different stages of maturation. So while they're maturing, with each maturing stage, let's get this working. With each maturing stage, you're going to have different types of follicles, which you see here in the name itself. You have a primordial follicle, your primary, your secondary, your tertiary, and you have a mature follicle. So the follicles all depend on what stage these eggs are going to be maturing. Now the ovary is held in place by several connective tissue ligaments. Now its medial pole is attached to the uterus by the ovarian ligament. These are ligaments over here. Now the central pole is attached to a pelvic wall by this suspensory ligament right here. Now the anterior margin of the ovary is anchored by a peritoneal fold called the mesovarium, which you cannot see within this particular diagram here. Okay. Now this ligament extends to a sheet of the peritoneum called the broad ligament. Then it flanks the uterus, and then it encloses the uterine tube in its superior margin. Alright, so I'm going to jump ahead just to show you the diagram right here. So the anterior margin is what I'll be talking about, which is the front portion, or the front area of the ovaries. It has this the peritoneal fold called the mesovarium. Okay. Now with that, there's a ligament that's going to extend like a sheet, which you see right here, and this sheet is going to extend for the peritoneum. It extends to a sheet of the peritoneum. So here's our very broad ligament, and this is the one that flanks. When I say flanks, it basically holds it in place, and then it encloses the uterine tube. So here it is flanking the uterus, and then it's going to enclose it. So it's going to wrap right around the uterine tube. All right, just in that superior margin, top. Okay. All right, so the artery, it receives blood. Sorry, not the artery. The ovary, it receives blood from two arteries. Okay. We have the ovarian branch, which is not shown in any of the diagrams, but we have the ovarian branch from branch of the uterine artery. So here's our uterine artery, This is our uterine vein. The artery is red. The vein is blue here in this particular diagram. That branch, the ovarian branch of the uterine artery, it passes through the mesovarium. Let's see if we get this going here. There we go. It passes through the mesovarium and then approaches the median pole. Now the ovarian artery, it passes through the suspensory ligament, which we see here. Passes through the artery, the ligament. See right here. Here we go. Passes through this ligament here and approaches the lateral poles. Now the ovarian artery is the female equivalent of the testicular artery. And it arises in a very high on the aorta, traveling down to the gonoid along the posterior body wall. So basically it travels from the aorta, passing on the posterior, the back side, or the behind, not the front side of the body, but the behind the body, down the wall of the body until it gets to the this particular ligament, the suspensory ligament. Let's go on to the uterine tubes. That was just our ovaries. Now we're looking at our uterine tubes. Now the uterine tubes, also called the fallopian tubes, as you heard me say earlier, these are little canals. They're approximately 10 centimeters long, leading from the ovaries on one side to the uterus. Now as the distal or the ovarian end, at the distal end, the uterine tube, it flares into these little trumpet shaped infundibulum. So they look like little feathers, and these are called fimbriae. Right here you see in the name, they're called fimbriae. Here we go. There's the name, fimbriae. These are little feathery little projections from the infundibulum. Infundibulum, I'm sorry. So this is the area where it flares out into a trumpet. Then you have these little projections from the infundibulum, sorry, that are called the fimbriae. Right. So the middle and the longest part of the tube here is called our ampullae, or ampulla. Now near the uterus, it forms a narrow isthmus, isthmus, and this is just the narrow end of the fallopian tube, this area right here. Now the uterine tube is enfolded in a mesosalpinx, which is the superior margin of the broad border. So here we have, which we see right here on this particular side. So as you see, there's major portions of the uterine tube. From the side that's closer to the uterus, we have our isthmus, which is the narrow end. Then we have the longest portion. In the middle is our ampulla. Then it starts to extend out and looking like a trumpet is our infundibulum. And at the end of the infundibulum, we have these projections called the fimbriae. Okay? So make sure you know these portions of the major portions of the uterine tubes. Now when we look at the uterus now, the uterus is a thick muscular chamber that opens into the roof of the vagina, and it usually tilts forward over the uterine bladder. Now what's its function? Its function is to harbor the fetus, provide source of nutrition, and expel the fetus at the end of its development. Now the shape of it, It is somewhat pear-like and has a broad superior curvature called the fundus. It has a middle portion called the body or the corpus, and then it has the cervix, which is that cylinder inferior end. So I'm going to go ahead to that area. Just follow along here in your notes, just to give you guys another visual of what we're talking about. This entire thing is your uterus. Sorry, not down here. This is your uterus here. We have various portions. We have the fundus. We have the, get this working here. We have the body right here, and then we have the cervix. So the fundus is that broad area. Get this working. Is this broad area at the superior curvature. So here's the curvature, and superior meaning above or on top. Then we have the body, which is the middle portion, and then we have the cervix, which is this, which is the at the inferior end, and it's a cylinder shape. Okay, this is the cervix here. Okay, this area. Now the uterus is about 7 centimeters from the cervix to the fundus. So 7 centimeters from here to here. Now it's about 4 centimeters wide at its broadest point. So we're not talking about down here, we're talking about up here in this fundus area. So from the broadest area, it's just 4 centimeters wide. And then it's about 2.5 centimeters thick. But it's sometimes larger in women who have been pregnant. Okay. Now the lumen of the uterus is roughly triangular, which is the 2 upper corners. Let's get this working. 2 upper corners into the uterine tubes. Now, in a person that's never been pregnant, or not in a non-pregnant person, the lumen is not a hollow cavity, but rather a potential space. So if you're not pregnant, it's considered to be a potential space. Now the mucous membranes are passed against each other with little room between them. Now the lumen, it communicates with the vagina via the central canal, which we have here. The cervical canal. And the superior opening of the canal, the superior opening of this canal into the body of the uterus is called the internal os, or os, and its opening into the vagina is called the external os. Get this working here. So these are our external os. Then we have our internal os. Now the canal, it contains cervical glands that are going to secrete mucus. Now near the time of ovulation, the mucus becomes thicker. It becomes thicker and always easier passage, and allows easier passage for sperm. Now the uterine wall consists of external serosa, which is the perimetrium. Now the middle layer is the myometrium. Let me see if I can show it right here. Here is our perimetrium, which is the outer layer, or the external serosa. This area here is our myometrium, which is the middle muscular layer. Then we have our endometrium. But of course you guys have heard of endometrium, because when it comes to menstruation, our endometrium, which is the inner mucosa. Now the myometrium, it constitutes most of the wall. It's the thickest one that we have between the perimetrium, the myometrium, and the endometrium. The myometrium is the thickest wall, and it's 1.25 centimeters thick in a non-pregnant uterus. Now it consists mainly of bundles of smooth muscle, and the muscle cells are shortest after menstruation, and up to 10 times as long in pregnancy. Now, what's the purpose of this myometrium? Basically, is there to produce labor contractions. Now, the endometrium, which is our inner meiosis, sorry, not meiosis, our inner mucosa. I don't know what I'm thinking about. It's our inner mucosa. It is made up of, just say, simple columnar epithelium. It has a stroma with leukocytes, it has macrophages, and of course other cells. Now, the superficial 1/2 to 2/3 of it is called the stratum functionalis, and this is what area that sheds during menstruation. Now, the deeper stratum basilis, it stays behind and it generates new functionalis each cycle. So when we look at, let me see if I can type this in here. Don't mind my writing again. Let's see, get a good color. Let's do blue. So, alright, so when we look at the endometrium, we're looking at the endometrium. The endometrium, it has basically, say it has like two layers. We have one that is the stratum, I'll put abbreviations, stratus functionalis, that's our SF, and then the second one is our stratum basis, our BS. So we have our SF and we have our BS. Our SF is the one that sheds during menstruation. Our BS is the one that stays around and helps generate more of our SF. Okay? Now the uterus, let me get back to my little pointer. Alright, so our uterus now is supported by a wall. It's supported by the wall of the pelvic outlet. Okay? And it folds of the peritoneum that form the superior ligaments. So we have the superior ligaments and the floor of the pelvic that helps support the uterus. Now, the broad ligament has two parts. The mesosalpinx, which you see here. Come on. The mesosalpinx and our mesometrium. These are the two parts of the broad ligament. This is the broad ligament I was referring to before. There are two parts: the mesosalpinx and the mesometrium. Now the cervix, let's see, alright, here's our cervix. The cervix and the upper part of the vagina are supported by the cardinal ligaments, which you see here. See more here. Supported by the cardinal ligaments or the lateral cervical ligaments. Now a pair of uterosacral ligaments, come on, here we go. The uterosacral ligaments attach from the posterior, so from the back side of the uterus to the sacrum. Now we have a pair of round ligaments. Here's our round ligament here that arrives from the anterior part of the uterus and passes through the inguinal canals, and then they're going to terminate at the labia majora. Okay, so of course the uterus, like every other part of, so you can get this erased. There we go. Like every other part of the body or every other organ, you have to have blood supply. So how is the blood getting to the uterus? Well, we have this ovarian artery. Okay, that, remember artery, if you remember from reproductive system, when you talk about artery, it's receiving blood from the heart and taking it out from the heart and taking it to the other parts of the body, oxygenated blood, and veins deal with deoxygenated from the specific site to the heart. Okay, so the uterine artery basically is receiving the blood, taking it in through this beautiful ligament, our suspensory ligament. Well, not through here, but these two blood vessels are within this artery, within this ligament, and it travels through the artery, which is on either side, and it travels through this broad ligament. Get my mouse working again. It travels through the broad ligament. So you see, within the broad ligament, you see all these blood vessels here. So the red ones are ovarian arteries. Sorry. Now when it travels through here, it starts to branch off. When it branches off, it starts to penetrate the myometrium. I'm on this side now. Our myometrium. So here are the branches off. Here are the branches, and the branch off into this myometrium. Then it leads to the arcuate arteries. Now each of the arcuate arteries are going to circle the uterus. On either side, correct? And it's going to give rise to smaller arteries along the way. So you start off at one artery, and as it continues and it gets to the myometrium, it branches off into smaller arteries. Now these smaller arteries are going to penetrate into the endometrium and produce spinal arteries that are going to supply the mucosa. Now the spinal arteries, which you see in here, not very well, but you do have these very small arteries in the endometrium. And the spinal arteries, rhythmically, basically they start to constrict and they dilate. So they open and they close, ensuring that the entire uterus is supplied with blood. Okay? Alright, so let's take a look at, let's take a look at, let's get that larger again. Let's take a look at pap smears and cervical cancer. Let's start off with pap smears. At the bottom of the screen, you may not have it on your slide because I just added it. At the bottom of the screen, you see a pap smear that is being performed. Yearly, females are supposed to go ahead and get their pap smears. The pap smears are started when females get their first menstrual cycle. After they get their very first menstrual cycle, they are supposed to see their gynecologist to get their cervix examined. Okay, during a pap smear, it's either they keep changing it. At first, it was when they turn a certain age, or at the menstrual cycle. I guess now they're starting a little bit earlier. Okay, due to the HPV disease that's occurring in a lot of females. So, what the pap smear is basically a screening test for cervical cancer. And what happens is that the gynecologist, OBGYN, they will actually use a plastic spatula, which is spelled S-P, let me see if I can spell it quickly here for you guys. It's S-P-A-T-U-L-A, a plastic spatula, and then a small little brush that you see there, and a small brush, and they'll insert the spatula into the vagina, into that area, and they would open it up so that they can see the cervix. They would take the brush, insert it in, and they would swab or scrape. They'll actually scrape the cells from the opening of the cervix, and then they'll take it out, put it in a small little tube, and then they'll take it to the lab and get it examined. And They'll examine under a microscope just to see if there's any abnormal cells. If there's any cancerous cells, human papilloma, the HPV, any type of STDs that can occur or can have these abnormal cells. Okay. So with cervical cancer, which is very common among women between ages 30 to 50, some cases that increases your chance of cervical cancer are smoking, STDs, early age sexual activity, and the HPV virus, the human papilloma virus. Okay, that should be 2 words, sorry. Okay, and it usually begins in the epithelial cells of the lower cervix. Okay, remember we talked about there were 2 areas. We have the internal os, then we have the external os, I can't even say an os, but os. But that's that area that they're going to scrape. Okay, this is the area that you usually see the changing of these epithelial cells, and that's why they scrape here, just to make sure that everything will be okay. Get rid of those. Okay, let's go down to the next slide. Now, the best protection against cervical cancer is early detection by the Pap smears. Okay, and I used to tell you that's where the cells are scraped and removed from the cervix and the vagina, and then they're examined under a microscope. Now, before you do before you get your Pap smears done, which I forgot to tell you, would be to make sure there's certain things you're not supposed to do 24 hours prior to the test. So you should not engage in intercourse 24 hours prior to. Make sure you do not wear any tampons, as well as douching. Those would actually change the results of, there'd be basically a less accurate result for the Pap smears, as well as make sure you don't go for your Pap smears during your menstrual cycle, which obviously will make sense not to go at that particular time. Okay. So when we look at the cervical cancer, there's 3 stages of cervical intraepithelial neoplasia. Now we have class 1, 2, and 3. With class 1, it's pretty mild dysplasia. Class 3, it calls for a biopsy, which you see, or don't see here, but this late stage, stage 1, and then there's stage 2. Then stage 3, it results may call for radiation therapy or either a hysterectomy. Alright, so let's look at our uterus. If you guys hear the dog in the background, I'm very sorry. The neighbor is barking quite a bit. But when we look at the uterus now, actually no, we talked about the uterus. Let me move on. These are all the slides here pertaining to the uterus that I was talking about. You know, I like to look at the diagrams so you guys get a vision of what I'm talking about. Okay. Also with the blood supply, and here is the diagram dealing with the blood supply to the uterus. Okay, here we have the aorta, which you know they say the heart. Let me get my heart in red. The heart is up here. We know it has its 4 chambers. That's my little X. Then we have the aortic arch, and that aortic arch is all the way down. So this is a continuation of the aorta. Okay. So this aorta, we have the blood supply to the heart. From the heart, entering into the ovarian artery, which is within that suspensory ligament. And it enters in. See how it's supplying the ovaries. It's supplying the uterine tube, or the fallopian tube. Okay, all the way through. Then you see it passes through this part of the broad ligament. This broad ligament, and you see it passes through, and it's gonna go through the uterus walls. We have the various layers of the uterine wall, okay, of the uterus, sorry. You see that it's going to supply. And you see these small spinal arteries that I was talking about that are found within the endometrium that are going to be contracting and relaxing at various throughout, well, all the time, consistently. Okay. So here's a better diagram of what I was trying to do for you. All right. So let's move on. Let's see if that will erase. What does? All right. So let's look at the vagina itself. This is basically the birth canal, and it's approximately 8 to 10 centimeters long that allows for the discharge of menstrual fluids, to receive the penis and the semen, and of course the birth of a baby. Now the vaginal wall is very thin but very dispensable, consistent of an outer layer and a middle layer and an inner layer. Alright, so the vagina, it tilts posteriorly, so it tilts backward toward the urethra and the rectum. And the urethra is behind its anterior wall. Now it has no glands, but is lubricated by the transudation of the serous fluids through its walls and the mucus from the cervix glands. Now the vagina extends slightly behind the cervix and forms a blind-ended spaces called fornices. Those blind little areas. Now the lower end of the vagina has transverse friction ridges or a vaginal rugae, which contributes to both male and female stimulation during intercourse. Now at the vaginal orifice, the mucosa, it folds inward and forms a membrane called the hymen. Now, which is ruptured by the first intercourse, if not by non-sexual actions before, such as condoms, medical exams, or any type of strenuous exercise. Now, the vaginal epithelium is simple cuboidal in childhood, but then it transforms into stratified squamous after puberty, and that transformation is called metaplasia. Okay. Now the epithelial cells are rich in glycogen, which bacteria flora ferment to lactic acid, producing this low vaginal pH, and this acidity is what is neutralized by the sperm. Now the mucosa also has antigen presenting dendritic cells, which are routed by which HIV invades the female body. Now the external genitalia, it occupies most of the perineum and are collectively called the vulva. Okay, now the mons pubis consists of mainly of an anterior mound of adipose tissue outlining the pubic symphysis, bearing most of the pubic hair. The labia, let me see if I have a picture of it. Oh, let me go a little further. There we go. Here is our pons pubis. This is where we find the pubic hair, and of course lined with is surrounded by adipose tissue. Okay. Then we have the let me see what's next. The labia majora. Might be off with the pronunciation here, but the labia majora is a pair of thick folds of skin and adipose tissue inferior to the mons, so it's underneath the mons. Now there's a slit between them, and that's called the the where is it here? Oh, not here. It's called the pudendal cleft. I'm just gonna spell it out for you guys quickly. Pudendal cleft, and that's that slit between them. Now, medial to the labia majora are much thinner lips. Let me get rid of this. Get back to my pen. We have the labia minora. Now, the area that's enclosed by them is called the, come on, here we go, is the vestibule. Or, yeah. And that contains the urinary and the vaginal orifice. Now, at the anterior margin of the vestibule, the labia minora is going to meet with a form of hood-like prepuce of the clitoris. There we go. And the clitoris is what you find in here. That's a structure like the penis in many respects, but has no urinary role. A lot of people may have thought that this is the area that you urinate from, and it does not. It has nothing to do with urination. Its primary function, or its function, is just for sensory. Just a sensory function. That's all it has. A sensory function. It serves as the primary center for erotic stimulation, and unlike the penis, it is also entirely internal, with no corpus spongiosum, and does not enclose the urethra. It is essentially a pair of corpora cavernosa enclosed in the connective tissue. Now, its head, the glans, you see in the bottom, in the bottom area, this bottom picture, I'm sorry, here's the clitoris. You have the glans, you have the crus. In the glans area, it protrudes slightly from the prepuce. Now, the body, the corpus, which you see here on either side, that passes internally inferior to the pubic symphysis. Symphyses, sorry. Now, at the internal end, the corpora cavernosus that divulges like a Y as a pair of crura, like these of the penis. Basically, it's going to split into a Y here. So that's why you have it on either side. So of the clitoris, you have the glans, and then you have the crus. Now, just deep to the labia majora, you have a pair of subcutaneous erectile tissues called the vestibular bulbs. Now, these bulbs, brackets, they are not seen in this particular yes, there. Sorry, right here. These are the bulbs that I'm referring to right now. Now, they become congested with blood during sexual excitement, and they cause the vagina to tighten somewhat around the penis. Then we have these glands here. This is vestibular glands, one on either side of the vagina. They look like a little pea right here, pea-shaped gland. And they have a little small duct. You know, glands always have ducts. These ducts, they open into the lower portion of the vagina. Okay, and they keep the vagina moist, and during sexual excitement, they provide most of the lubrication. These two glands provide most of the lubrication. Vestibular glands. The bulbs are the ones that accumulate with with blood during sexual intercourse and cause the vagina to tighten. Okay, so make sure you know the difference between the vestibular bulb and the vestibular gland. Now, the vestibula is also lubricated by a number of lesser vestibular glands. We have a pair of mucus skein glands, which are very similar to the male prostate, and they open into the vestibulae near the external urethral orifice. Alright, so let's move out of here and let's talk about the breast. Now, the breast, already know, is a mound of tissue overlaying the pectoralis major, which is the muscle, the pectoralis major, that chest muscle right here, and it enlarges at puberty in a female. Now, the mammary gland, it develops within the breast during pregnancy, and it remains active in the lactating breast and atrophies when a woman ceases or stops breastfeeding. Now, the breast has two principal regions. It has a body and it has an auxiliary tail. The body is basically where the nipple is to the apex, with the nipple at the apex, and the auxiliary end is basically from the extension from the armpit was the extension from there towards the armpit. So this is the auxiliary region, and this is the body. Okay, and we do have lymphatic, as you see here, these little lymph nodes. We do have lymphatics of the auxiliary tail. There may be a route of the breast cancer metastases. Okay. Alright, so when we look at the nipple itself, it's surrounded by the areola, which is a darkened region. And this is where the blood vessels and the nerves are closer to the surface. We have sensory nerve fibers there in the areola, which are very important to triggering the milk for nursing mothers. And also, you do have some hairs that you may find in the areolar region and some glands, which are even intermediate between the sweat glands and the mammary glands. So when a woman is nursing, secretions of the areola glands and the sebaceous glands, they protect the areola and the nipples from chapping. Oh, here's it right here. Alright, so here's the areola glands right in here. And here's our mammary glands. There's our sebaceous tissue, our fatty tissue. And here, the lobes of the mammary glands. And here is our areola. Okay. Alright, so if it's cold outside, if the nipples are touched or the areola is touched, or to have a sexual arousal, the skin or the derma of the areola has these smooth muscle fibers that are going to contract. Okay, any type of those with those type of responses. Now, internally, the non-lactating breast consists mostly of adipose and collagenous tissue. Now, the breast size is determined by the amount of adipose tissue and has no relationship to the amount of milk that the mammary glands can produce. Now, this is with a non-lactating breast. Now, sebaceous suspensory ligaments attach the breast to the dermis, as you see back here. Here we have the suspensory ligaments. They're going to attach the breast to the dermis of the underlying skin and of the fascia of the pectoralis major. So there's our pectoralis major, these little things here, those are the ribs. Now, although the non-lactating breast contains little glandular tissue, it does not have a system of ducts branching through the fibrous stroma and converging on the nipple. Now, when the mammary glands develop during nursing, it exhibits about 15 to 20 lobes arranging um, radially around the nipple, separated by the stroma. Now each lobe is drained by a particular duct, lactiferous duct, which dilates to form this lacteous sinus opening into the nipple. Now these sacs that we have here, the acini or acini, they're organized into these grape-like structures, or these type of lobules. And the acinus is surrounded by a network of contracting myoepithelial cells. There you go. So here is a diagram of what I was talking about. Here is your nipple. Here are the here's the areola. You have the areola glands that you see here. Here are our lactiferous ducts and our sinus. Here are the lobules, or the acini. Here are the lobe. Here's the fatty tissue, adipose tissue, and our suspensory ligaments. Here's another view of what it looks like. This is of a cadaver. Some more diagrams. You know, I'm big on diagrams. This will help you guys with understanding where these various things are located. Alright, so we look at breast cancer. Breast cancer, wow, it's very common. You have 1 in every 8 to 9 American women, and it is the leading cause of death in females. Now, breast tumors begin with cells of a mammary duct, and then they may metastasize to other organs by way of mammary and axillary lymph nodes. So it may start in the breast, and if not caught early, it can actually spread to various organs through the lymphatic system. So that's what they're talking about, how the lymphatic can metastasize the mammary and axillary lymph nodes. Okay. Signs of breast cancer includes, of course, you may have a lump or a tumor that you may palpate yourself, where they have you do self-examinations, puckering of the skin, changes in the skin texture, and of course if there's a discharge from the nipple. Now there's 2 breast cancer genes. Those were discovered in the 1900s, and they are the BRCA1 and BRCA2. Most breast cancer is non-hereditary. Sorry. Some breast cancers are stimulated by estrogen, and therefore breast cancer is more common among women who begin menstruation early and reach menopause late. Wow. So other risk factors include aging, exposure to ionizing radiation, carcinogenic chemicals, excessive alcohol and fat intake, and of course smoking. See, smoking seems to be a leading cause in a lot of diseases. Now, over 70% of cases, they lack any identifiable risk factors. So the majority of tumors are discovered during breast self-examination, or BSE, which should be done monthly by yourselves at home. They tell you to make sure you check every month, see if you feel any lumps, and of course by mammograms, which are there to help to check tumors too small to be identified by your breast examination, your breast self-examination. They usually start in your late 30s, which would be a baseline for your mammograms. And they used to actually started at 40 years old. And it used to be 50 back in the day, but now they've changed it to, they're trying to get it down to 30s. A lot of doctors trying to get it down to 30 just because of the rate at which the younger generation is being diagnosed with cancer. So they're trying to get it down to at least 30 years old, or if you have a hereditary trait, a very strong hereditary trait of having cancer on both sides of the family. Try and get you guys to get in earlier, as well as the insurance companies. They're not even going to cover it at an early age unless you have a high risk. You're considered a high risk for breast cancer. Like if both parents have cancer, or grandparents as well as both parents, then you're considered to be high risk, and you'll be able to get a breast exam at that time. So they say a schedule commonly recommended is it has a baseline mammogram of 30 years in your late 30s, and a mammogram every 2 years from ages 40 to 49, then every year beginning at age 50. But if you have a strong hereditary trait of breast cancer on both sides, so females, make sure you talk to your doctors about that. You can get it every year with your regular gynecologist checkup. Okay. All right, breast cancer treatment for breast cancer. You have a lumpectomy, which is the removal of a cancer. So they'll go in through a small incision and remove the cancer. That's a lumpectomy. They made a simple mastectomy, which is the removal of the breast tissue only, or breast tissue and some axillary lymph nodes. And then you have a radial mastectomy, which is the removal of a breast, which you see here, underlining muscle, facial, and lymph nodes. Okay, now surgery is followed by radiation or chemotherapy. Depends on what stage you're in. You may have to do it for 18 weeks, 10 weeks, so it depends what stage and how, if it has spread severely. And breast reconstruction from fat, skin, and muscle from other parts of the body that can help with putting it back, or if people want to do plastic surgery. Okay. Alright, so that is the end of our part 1. So if you have any questions, please go ahead and post them on Blackboard. I'll try and get to them as soon as I can. But go ahead and start on to the next part.